Welcome back everyone. In today's session, we'll be discussing about a new research project, the efficacy of oral versus olfactory administration of medicines in acute diseases, a pilot study. This study was done in Alva's Homoeopathic Medical College. The project was funded by Rajiv Gandhi University of Health Sciences under the Students Research Grant 2019-20. The project was done by the student Haniya, Raslin. It was guided by Dr. Herald, Roshan, Pinto, Principal of Alva's Homoeopathic Medical College, and myself, Dr. Dhivya. The project is about, most of the times we as a homeopath, we use oral administration of medicine rather than any other route of administration. But technically, the other system of medicines prefer both the routes of administration, and if you see, the time taken for the absorption and the action to attain after the administration of medicine is shorter in olfactory method rather than the oral method. The oral method takes 30 to 40 minutes time, whereas olfactory method takes around 2 to 3 minutes. So it is a very huge difference, but we homeopaths never use it. So this study was to aim whether the same difference is noticed in homeopathy also, whether it is more effective in oral or in olfaction. This was the aim of this particular study. And even Haniman in the Fornon under aphorism 288 have emphasized the importance of olfactory administration of medicine also in Metra Medica Pura. Considering these factors, this particular study was designed to understand whether both oral and olfaction is similar or is it better, which way it works. So just for that knowledge, this particular research was designed and conducted. For this study, ethical committee clearance was obtained from the institutional ethical committee, followed by informed consent form was obtained from the volunteers. Total of 30 cases were selected, where 15 was in group A and 15 was in group B. Purposive sampling technique was used. There was matching done between the groups so as to avoid the sample bias. And no negative controls were taken in the study considering the benefit of the patient. The case taking was done according to the case format of Alva's Homoeopathic Medical College, and totality was framed and the medicine was prescribed. Repetition was according to the need of the case. The inclusion and exclusion criteria for this particular study is it should be an acute disease, no comorbidities, no other medications should be there, and no emergency situations. The time taken for the oral group and olfactory group for the cure or relief of symptoms was recorded in terms of minutes. So this was the project methodology followed, and the data was tabulated. The study data was then analyzed statistically using independent t-test. Mean value of olfactory group is 18.53 minutes and mean value of oral group is 64.5 minutes. So considering the value and data using the t-test, the p-value was obtained as 0.01, which shows it is highly significant. So therefore the conclusion made is olfaction and oral helps in the relief of patients, but olfaction acts faster than the oral. You can see the olfactory group the mean value is 18 and the oral group's mean value is 64. There's a huge difference. So this itself proves the olfactory method is more faster in acting compared to the oral method. Hope this was useful for you. Meet you again with some other interesting topic. Take care.